Over the last 10 years, emergency services across the United States have experienced an increase in the number of patients seeking care in emergency departments. And emergency departments can be very crowded and noisy, and there are people moving everywhere and lots of glass walls with limited privacy. Thanks to a $1 million gift from a grateful anonymous patient, combined with the commitment from the Centra Foundation, we've been able to bring a new concept to behavioral health care for our region called EmPATH. And EmPATH stands for Emergency Psychiatric Assessment, Treatment, and Healing Space. So this creates a unique space within the emergency department dedicated to behavioral health patients and their family, with the goal of treating them immediately and transitioning them back to community resources versus admitting them to the hospital for care.
Right from the beginning, when they step into the unit, it's a different environment. We have advanced practice providers, we have psychiatrists, we have mental health consultants, we'll have social workers. So it's a more focused way to provide care in a more appropriate space.
The space is really designed to be this open, beautiful, calm treatment space where patients can go to start receiving immediate care. The space will also have a communal area with table and chairs where patients can go to interact with each other, play games, or sit down and have a snack. The space also has two private areas. One is a consultation room where the patients can go to have one-on-one treatment and interaction with our care team. And then the other is a sensory room for those patients that just need a few moments where they can step away from the community environment and just have a quiet, calm space.
I'm so excited to have some sort of resolution for our patients that are boarding in the ED. I mean, this is a national crisis. It's not unique to Virginia. Bringing this across the country would be wonderful to see.
So we have had an incredible collaboration here at Centra. It is really the most powerful collaboration between behavioral health services, emergency services, our foundation, and the hospital as a whole. So by having a better service at Lynchburg General, that provides more space for patients at other locations.
It's on the top 3 in many communities in Central Virginia, a need for mental health support. So Centra is taking the initiative, is taking the first step to address those needs immediately.
We are incredibly grateful for the anonymous donor and their leadership through philanthropy. The donor expressed appreciation for care received here at Centra and wanted to help address our greatest needs. The need for EmPATH is great, and the Centra Foundation is committed to funding the construction and first-year operating expenses for the unit. Donors can support this project with a gift to the Greatest Need Fund. Together, we can make an impact on the well-being and quality of life for behavioral health patients who need excellent emergency care.